Hello there, my beloved listeners. If there is any greater radio joy than sharing the safe harbor of the studio with you on this Monday morning, I do not know of it. Thank you for keeping your dial tuned to WMNF Tampa, your resistance radio station from Tampa Bay to the Gulf of Mexico, and the only venerable little FM station that Andy Sipowicz would ever stream when he's not on the job. And you can stream us as well at WMNF.org. Today is Ask Me Anything Monday, and that opens up a deep, deep well of possibilities. The whole shebang depends on your medical questions, comments, and concerns. So let's keep Sage, the masterful soul of the control room, busy this morning. Just give us a call at 813-239-9663. That number again to share your medical questions and concerns is 813-239-9663. Or you can send an email to dj@wmnf.org or text us at 813-433-0885. Good morning to you, Dr. Harvey. Let me tarry no more. What have you got to get us started today, Dr. Fred?
Well, Bill, and happy Monday.
And back at you. I hope you had a wonderful weekend.
It was delightful. Thank you. And I hope everybody else had an enjoyable one too, because it was such a beautiful weekend. And so much goes on. I had a couple of things lined up to talk about, but the NPR News got me on a different tangent. Stress on rural hospitals. This is nothing new. This is something that I have witnessed personally in my life. Being a doctor, it directly affected me. And being from a rural community in Western Pennsylvania, it directly affected me. My hometown, when I grew up, had a small hospital, a state general hospital. It had about 40 beds, half of which were occupied at any one time. It wasn't a busy place. When I grew up, there was no such thing as an emergency room doctor. In fact, the emergency room was not staffed by doctors. Yeah, think about this. A nurse, a triage nurse, hung out in the emergency room. When a patient would arrive via ambulance, the nurse would call one of the doctors after she triaged the patient. And usually it was, either there was a surgeon or a medical doctor or both on call, and then she'd call the one that was appropriate for that issue. And so then it took the doctor that time to get to the hospital. A very interesting, different situation. But it was all we had. And this hospital served, I think it was about 60,000 people in the region. But as the government often does when it's controlled by a certain group that loves, I would say in quotes, fiscal responsibility, because that's all they talk about, but they are the most fiscally irresponsible group in our government. In fact, every time they've been in control of the White House and or Congress, they've tanked the economy. And every time they're in control of both, they tank it twice as hard. They're in control of Congress and the White House and the Supreme Court right now, and it's tanking. And I was working at my hometown hospital after I got out of residency in the late 80s, but there was a president at the time who hated welfare queens and rural hospitals. And so he starved them. And Ronald Reagan was responsible for the closure of a huge amount of mental health hospitals and rural hospitals. It's happening again. The same party, the same tactics, the same squeeze. Let's make rural America suffer, because that's what they do. And they're closing rural hospitals again. They are putting them under fire. People are not going to get the care that they deserve because the government's going to make sure these care facilities get hurt. Because it's in the fascist economic government's interest to have its fascist associates with bigger profits. And that means small hospitals get closed and people have to go to bigger corporate chain hospitals to get care. This is really a problem. This like centralizing of care really is what it is. It's like one corporation controls everybody's healthcare. This is wrong. I mean, individualized care is so much more important. That's why I practice personalized medicine. Each one of the clients that I see really gets a lot of time because they're very complex cases. It's not primary care, it's high level care, and I need the time to do it. But primary care also needs time and money and facilities, and they're being closed. We're going to see a rash more of small hospital closures. And this is dangerous for America and Americans. It's going to cause more death. It's going to result in more people with less access to healthcare, and more people are going to get sick. How can we make America healthy again? Oh, I guess that's after we make it really sick. Is that the point here? It's rather a confusing Orwellian doublespeak that we're dealing with here now, where the head of Health and Human Services talks about maha-ha-ha, whereas the rest of the government talks about tear it down, make sure they don't get access, and let them suffer. It's really a sick, psychotic dichotomy that we have to deal with here. It's very stressful. Hospitals are stressed out. Hospital employees are stressed out. Patients who know that their doctor's going away and their hospital's going away, they're stressed out. I don't know how this makes everyone healthier or happier. And I'm really tired of watching so much winning. Can we win a little bit less than this? Because really, it's painful winning when winning includes the destruction of America's health systems. They're not that great, but they're there. And we're losing more access. And this actually really turns it around to the way I look at our health reality. My job is to help you be empowered so that you don't depend on a system that doesn't exist and it's going away even more. Because we don't have a healthcare system. As I've told you, we have an illness care system. So yeah, if you have acute illness, you might get some help. You might, if you can find a hospital that's open. So really, we need to do it on our own. Some studies came out recently. This is what I was going to lead with, is that there's some simple stuff we can do, really simple stuff. And it goes back to changing some of your choices about what you're eating. One of the biggest things you could do is eat oats. There's a big push for carnivores. The head of Health and Human Services says he eats meat and ferments. A little weird, I think. I'm a Scot. I'm 39% Scottish by genetic heritage, and oats are my grain. I feel good when I eat oats, and a lot of people actually do. Small study, yeah, I gotta admit, small study, but 17 adults ate 300 grams of oatmeal. That's 10.5 ounces of oatmeal made with water, not milk, occasionally having some fruit, and they ate nothing else each day for 2 days. They lost 2 kilograms, and their LDL fell by 10%. Gut health and blood pressure also improved. This is brilliant because we have such a push to do high protein diets, but what we're missing is that our bodies grew up on fiber. We have flat molars. We were meant to chew fiber, and lots of it. And plants have the monopoly on fiber. You don't get it from eating a liver or a steak or a fish. You get it from eating plants. And oats are one of the best that you can eat. Oats have a soluble fiber. That slick feel of the oats, that's actually highly beneficial for your belly. The bacteria in your belly ferment that and turn it into this amazing, amazing thing that supports your colon. It supports your liver, and it supports your muscle energy. 3 things, actually. It's short-chain fatty acids is what it makes, but butyrate supports your colon, propionate helps your liver and helps it reduce cholesterol, and acetate acts like sugar for fueling your muscles, so you don't even need to eat sugar. You can just eat lots of oats. So oats are going to help metabolic syndrome. They're going to help you lose weight, lose blood pressure, and control your blood sugar. It's amazing. I don't think that you should just eat porridge for 2 days. I think you should incorporate it into a regular diet like I do. Sometimes I eat oatmeal bread. Sometimes I have oats for breakfast. Sometimes I have granola with some oats and some coconut and some walnuts and some raisins or something like that. But in any event, I get oats on a regular basis because I feel good when I eat oats. And that leads us to some reminders that I'm here to talk with you. And I think we have somebody on the phone right now who does want to talk about the rural hospital problem.
Actually, we do have two. I've got Bill from St. Pete and Mark from Sarasota, but I'm going to invite the whole universe to participate in the Healthy Steps radio show with Dr. Fred Harvey here on WMNF Tampa. You are invited to give us a call and participate in the show with your medical questions or concerns by calling 813-239-9663. Sage has come on in to take that call as the star that she is, and that number, one more time, is 813-239-9663, and I see the light flashing of somebody taking advantage of that. And you can also take advantage of using our emails. Just send it to dj@wmnf.org. Let's go to Bill. Good morning to you there, Bill.
Hi, good morning. Thank you. I have to agree with the speaker as far as the medical, what we have access to under our current administration, even though he never said that. However, he did imply that it was, when the mentally handicapped were out in the streets, according to Reagan, who was also a Republican. But here's the problem. I have many relatives out in the rural area of Alabama. Pell City, Alabama is as far out in the sticks as you can get outside. But every one of them voted for Trump. And so it seems like they're getting what they voted for, and I hate to say it. They even had a falling out with me because I had a Harris sign in front of my front yard. But it seems like the politicians who were saying, I can help you with the medical, I can help you with insurance, the people who are voting the current president in office, now they're meowing and barking about how come we can't get medical assistance in our areas because the president is cutting funding maybe the last time now for the wars. I'm just saying that because I just heard that about the rural areas, and I do wholeheartedly agree because I have relatives out there. They got to drive 45 minutes to see a doctor. But
yes, I agree. That's what happened to my hometown. When they closed the hospital, 45-minute drive.
Well, my cousin in Alabama, my first cousin, I'm not lying. I'm a certified Democrat, a retired PhD. But she would rather drink wine before it's time than vote for a Democrat, but she'd rather put up with the current situation that Trump is proposing to the United States. It just boggles my mind. That's all I got to say.
Yes, but there's really good reason, though. Bill, there's really good reason. Low information, low intellect voters tend to be swayed by emotional BS. And the same low intellect, low information voters are actually stuck in areas where they have information deserts, like food deserts. Like I drove across Pennsylvania a couple years ago, and through the center of the state, it's a food desert. It's like Western Texas. You get fried pickles and stuff. But when you look at these people, that they are basically educated by Fox News, and Fox News lies. Fox News manipulates people. Fox News is not news. It's actually manipulative propaganda, just like Joseph Goebbels did during Hitler's regime, where he just lied to people and convinced them that it's worth it to stuff Jews into ovens. I don't think we're that bad here, but we're stuffing brown people into concentration camps, just like we did with Japanese in World War II. So, the cycle goes round and round, and we're back to the point where we have to actually fight fascism again.
You hit the nail on the head, Doctor. You're absolutely correct. I cannot agree with you more, and I just wanted to say that I understand what you're saying because I have relatives in that situation right now. And, but you're not going to change their thinking because of the lack of education, and they believe anything that they've been taught.
No, the only way we can change it is by continuing to love and love and love and hope that the love breaks through the fear, because it's fear that's driving this kind of stuff. Thanks a lot for your input today, Bill.
I appreciate it. Bye-bye.
Thank you very much. That was good points there. And let's go to Dan in St. Pete. Good morning to you, Dan.
Hey, doctor. Listen,
Hello.
I got this, Dan Harvey, St. Pete. I got this chest cold, and I'm taking some Augmentin. It seems to work pretty good in the years before I had this. What's your opinion of Augmentin for like a little hacking annoying?
Well, I think that antibiotics are well overused for upper respiratory infections. I think that most are viral. Many are what appear to be upper respiratory infections are actually irritations. Like we just came through the worst pollen season with no rain, and finally got rain. So that might improve a bit. But truly, most doctors give antibiotics too early. There's really good clinical evidence that a bronchitis will resolve in 3 weeks, and you don't need antibiotics to do it. A sinusitis will resolve in 3 weeks, and you don't need antibiotics to do it. But if you get to the 3-week point, you're still having green gunk coming out of you, you really might want to consider seeing a pulmonologist or an allergist or somebody who can evaluate and see whether or not at that point you need antibiotics. But they really aren't necessary earlier than that point, because most people's bodies are resilient enough to kick it out, unless you have some immune challenge.
Okay, all right.
So no, Augmentin is overutilized.
All right, sounds good. Thank you.
You're welcome.
Bye.
Bye-bye.
Thank you very much there, Dan. Let's go to Karen in Tampa. Good morning, Karen. What have you got for us today?
Hi, I was calling to talk about osteoporosis, and I'm trying to not take osteoporosis, the medications that my doctor wants me to take, and do it by lifestyle supplementation. And I wanted to get your point of view on all that.
Well, I think that most doctors don't follow your bone metabolism, so they can't really tell you whether or not what you're doing is working. There's a test, a couple of them actually, N-telopeptide, abbreviated NTX, C-telopeptide, abbreviated CTX, and PINP, procollagen N-terminal peptide. These are indicators of your bone or your body's collagen production and breakdown. The PINP tells how much your body is actually making the collagen, and the other two tell how much your bone collagen is breaking down and being urinated out of the body. So assessing those can, before you begin a program, can tell you whether or not you have an issue. So if you're not on a osteoporosis medication, which immediately changes those numbers, and then you can't tell what's actually going on in your metabolism because it totally disrupts your bone metabolism. You get those tests done beforehand, and then you can start a program, something that may contain orthosilicic acid and exercise and vitamin D and lots of plant material to get some really good minerals to augment the calcium. And then eating things like canned salmon that has the bones baked in, so you get some really good organic calcium in your food. You don't need dairy to do this. And then make sure you're doing your lower extremity work, doing some resistance training, squats and lunges, and then see if those numbers change. If those numbers get better, then it's likely your lifestyle program is working. But if you have a number on your DEXA scan, the bone densitometry, where you're at a -4 or something like that, you're in serious trouble. And you may want to consider using some of those medicines to shore up the bones while you're taking a 2-year course of lifestyle changes.
Well, I do have one number that's a -4, but I have, since the beginning of the year, started everything you were just saying, other than those tests, which I would like to get.
Yeah, you can order those at any lab test now if your doctor doesn't feel like doing it for you.
Oh, so I can just go to one of the labs and they'll do it?
Well, it's actually any lab test now. You can't just go to one of the labs because they won't do it.
Okay. And I can just look that up. Okay, that's helpful.
Yeah, you order your own at any lab test now. You need a doctor's order anywhere else.
So if I'm at a -4 in just one area, is that hard to come back from? When I wasn't previously exercising and taking my calcium supplements, and
you've got a 2-year course of rebuilding your bone.
Okay.
You got to make sure you're getting your 70 to 90, maybe even 110 grams of protein a day, too, to shore that up.
Okay. 70 to 90 grams of protein a day.
Maybe even 110, depending on your size. I'm not sure about your size, but actually consulting with a functional medicine doctor to get the specifics on it would be a good idea, too.
That's what I was going to ask you. Who's the best person to oversee this?
ifm.org. Go to the physician finder. You can find one within a few miles of your home.
Okay, great. I appreciate it.
You're welcome.
Like
have a great day. Good luck with the bones.
Thank you. Bye-bye.
Thank you very much there, Karen. And I do have Jerry in Clearwater waiting, but he's waiting alone, and I want to have everybody join the party. You are listening to the Healthy Steps Radio Show with Dr. Fred Harvey here on WMNF Tampa, and you can join the party with your medical questions or concerns by calling 813-239-9663. Plenty of you have been sending on in emails, and you can do that at dj@wmnf.org. But the easiest way to get in is by dialing 813-239-9663. Let's go to Jerry. Good morning to you. How are you today?
Fine, thank you. Thank you for taking my call. I just have two quick comments to make, and I'll hang up and make room for somebody else. The first one is I've noticed in the hospital desert, so to speak, or medical deserts, and most of these do come from the poorer countries. The people that are most in need of it are voting against their own best interests. One thing I have found in common among those people and so-called Christian nationalists is this one statement: I hate to read. That's the end of number one statement. Number two.
Hey, a comment before you go, though. There's a license plate. There's a license plate that has a snake on it, and it has a saying on it, but the saying for me says, "Don't read to me. It hurts."
You got that right. And they stop listening as soon as.
So what's your second comment, sir?
It's a psychological thing. They take it as a personal attack.
Yes.
They go into defense mode. Fight or flight, I guess they call it. But anyway.
It's identity issues. People often identify with the club. So if you say something against anything, say Democrat, you're going to have a hardcore Democrat identifier feel that they've been personally attacked. If you say something about the orange mobster, somebody who's identifying as a hardcore Republican MAGA hat wearer is going to feel personally attacked. It's natural, normal psychology.
Exactly. And in my opinion is, if I don't listen to people who disagree with me, I'm not going to learn anything.
That's right.
That's what I think. But anyway, my other statement was I'd made a comment about illness and races. And you said, well, there were no races. And it's, you're correct. I did some personal research, but there are a lot of differences that are based on neglect, which is where your racism comes in.
That's the key.
There are also a lot of differences that are based on ethnicity genes. For example, me, myself, I am like you. I am Scotch. And Scotch-Irish and Europeans have a gene that makes cilantro, only 12% of us, taste like soap. It's absolutely the most revolting. Blech. But 83% of us think it's the greatest thing since cat's pajamas.
It's true.
My wife is Chinese, and she's more prone to lupus. She's more prone to prednisone blindness. It goes on, and you have to be very careful. It does have to be taken into consideration. And the damn thing of it is people have got so, I don't know, touchy-feely or whatever you want to call it, that if you say a statement like that, they're going to say, oh, God, you're a racist. That's what it is.
It really,
rather than thinking.
Jerry, it really is a statement that comes from racism. The better statement would be to say that we have very significant biochemical individuality. No two humans will respond the same way to any one challenge.
With vision, I saw a thing on the brain last night on Nova, if you get a chance to watch it. And we all see different colors.
Exactly. And so
shade of this or that or whatnot or another. But ethnically wise, I know that you and I are never going to get sickle cell. But I also know that you and I are more prone to respiratory infections and et cetera, et cetera. And I also know that heart disease and diabetes among blacks are more as a result of neglect
and the impoverished food choices.
You know,
so it's not really race. It's genetic individuality. It's nurture, because nature is your genes. Nurture is what's going on around you. All this comes together on everyone, and so it's not really race. It's genetic individuality.
Yeah, there is some ethnicity though that encourages that particular gene formation.
Yeah, there definitely are gene combinations that go in populations, but that's actually population genetics, again, and not race.
Oh, I agree. Not race, but ethnicity has a lot to do with a lot of these, just like Sachs disease, et cetera, et cetera.
Oh, yeah. No, it really, I mean, families breed the same genes. And so, yeah, you're going to share in that group. It's just what happens.
If we can agree on that, we're good.
Yeah, I mean, we do share the genes. So there's no question about that. When you're in a group, you're going to have that group's stuff.
Okay, well, great. You have a great show, and thank you very much for that statement. It encouraged me to do research because at the time I disagreed with you. And as I said before, if you always read stuff you agree with, you're never going to learn anything, damn it.
Expand your consciousness, my friend. I love it.
And Fox does not lie directly on their news shows as much as they lie by neglect. I can tell you 80% of any story, and I can make it sound like exactly what I want it to sound like.
It's so true. That's called propaganda. We hear a heck of a lot of it. Jerry, you have a great week. Talk to you again.
Personal shows. You take care. Thank you.
Thank you there, Jerry. And now we've gone dark, and I do not like that. I'm going to encourage you to give us a call at 813-239-9663 while the doctor looks over some of the emails, and then you can participate with your medical questions or concerns. Just give us a dial at 813-239-9663, and we'll plug you right on into the Healthy Steps Radio Show with Dr. Fred Harvey here on WMNF Tampa. And since he already is going to the mailbox, you can also sneak in there by sending your emails to dj@wmnf.org. So back to you, Doctor. What have you got?
Well, I was going to mention something more about plants because I'm really loving what I'm reading about them these days. This is a great article I just looked at in Journal of Functional Foods from last June. It's Herbs and Spices as Functional Food Ingredients, a comprehensive review of their therapeutic properties, antioxidant and antimicrobial activities, and applications in food preservation. You know, our ancestors knew about this. Clove and ginger and garlic, they keep bacteria from growing in your food. And so, we found a industrial oil complex, a chemical complex that loves to create chemicals that do this stuff, but the chemicals tend to hurt us. And so we might want to consider that there's a bunch of different things we can do with plants that are really helpful. And it leads into the eat a rainbow concept. The more plants you eat, the more likely you're going to have a healthy microbiome and a better overall health. And these plants have so much effect. I just talked about fiber. That's its easiest low-hanging fruit, but there's so many different phytochemicals that help stabilize us and help to improve everything about the way our systems work, to help clean up the liver, to help eliminate diseased cells, to help to have cancer cells commit suicide, so they don't bother the rest of the cells in the body. These things really help to rebalance our bodies. Things like alkaloids and flavones, terpenoids, flavonoids, curcumins, flavones, phenols, so many different amazing chemicals that promote better body function. We've lived with these plants for hundreds of thousands of years. One source suggests there's 21,000 medicinal plants. There's probably more that we're killing in the Amazon right now that we don't even know yet. And so finding more plants, eating more plants, using more plants is more healthy for everyone. I think we have a caller.
Actually, we've got a pair of them. I've got Kathy and Pat, and let's go to Kathy. Good morning to you, Kathy.
Good morning, Dr. Harvey.
Good morning.
Good morning. I have foot pain. 2 years ago, I had an x-ray. I have bone spurs on my heels, no fracture, and Achilles esophagy. It's a continuing problem for me. I don't want to walk much. It hurts a lot. Any suggestions? I ice it.
So what you're describing is chronic tendonitis. The enthesopathy of your Achilles tendon means that the tendon on the back of your heel is pulling up and causing inflammation. And then the tendon underneath your foot is usually the bone spur people talk about, the plantar tendon that comes off the bottom part of the heel and usually causes very severe pain on the bottom of the foot when you walk.
Yes.
And so the normal course of therapy for that includes anti-inflammatory medication, stretching, posture work, and strengthening. So have you been doing the posture work?
Yes, the past 2 years working on my posture. My massage therapist said walk more on my toes.
Oh, you have to walk less on your toes because walking on your toes is actually what causes the problem.
Okay.
So you should talk to actually a kinesiologist, not a massage therapist, somebody who understands body movement therapy. I knew there was a really good kinesiologist in St. Pete a couple years ago, but I'm blanking on the name. But a physical therapist also understands this. A Qigong instructor understands this. A yoga therapist understands this. And a muscle activation technique therapist understands this. It's all about the posture. You're leaning forward, walking on your toes, stretches out the plantar fascia and the Achilles tendon, putting constant pressure on it, causing constant inflammation and severe pain.
Yeah. All right. So I need to work on that some more because I have flare-ups.
Yeah. So you need a good therapist that's going to help you figure out how to deal with this. And then there are also some devices you can do, some things you can roll your foot on. I would get to some other therapists. Class 4 laser helps to reduce inflammation. There's so many different techniques that sounds like you're not using.
Okay, I concerned that these bone spurs might dig into my tissue and cause sores, something like that.
Your bone spurs are actually calcified chronic tendonitis. It's in the tendon. There are no bone spurs sticking out anywhere. It's your tendon being constantly inflamed and dying. Stop killing it.
Yeah, all right. Thank you, doctor.
You're welcome.
Okay.
Find some good therapists.
All right, I will. Thank you.
You're welcome.
Thank you, Kathy. And I know that's annoying, so best wishes to you straightening that on out. And we are looking in the eyes of just about 20 more minutes of this show remaining. And I'm going to make Pat wait a second while I encourage you to participate in the Healthy Steps radio show here on WMNF Tampa and give your medical questions or concerns a little bit of airing by dialing 813-283-8255. 239-9663. As I said, Sage has come on in to take those calls. So let's make it easy. The number 813-239-9663, and continue to send your emails to dj@wmnf.org. Good morning to you there, Pat.
Hey, good morning. I have a comment and a quick question. You were talking about reading. I'm on, right?
Yes, you are.
Okay. Earlier, you were talking about reading, and I have to tell you that I was a teacher at an Ivy magnet school, Booker T. Washington in Ybor City. I don't think it's there anymore. But I used to tell my students, ask my students, what is the difference between students who are taught to read but choose not to read, don't read, and people who can't read. And I contended that somebody who can read but doesn't, and somebody who can't read and doesn't, they're in exactly the same place. So that's just food for thought. And by the way, many people in Florida cannot read. Many adults in Florida are not able to read. So I just wanted to comment. So, but my question, like the lady before me, I have pain in my heels of my feet. I think it's neuropathy. It is it's not there all the time. It feels like I'm walking on bruises in the heels of my feet. And so I had an MRI done. You know, I'm getting older, so I think it's probably some aging stuff. But the doctor has given me a prescription for gabapentin, this before doing any physical therapy or checking for any vitamin deficiencies. So my question is, should I take this? I think it's gabapentin. Shouldn't I do physical therapy and get my vitamins checked in case I'm deficient on something before I take a pill?
You ask really good questions. The flow that I use for any kind of care, for any intervention, is first to, really get an extensive history. Why are you experiencing this? And, watch you walk, because your walking is contributing. And then after we, dive deep into history, it's likely that, some testing would be done. An MRI would probably show whether or not you have tendonitis or calcification. Was it negative?
I don't think he tested for that, but it is some kind of osteo something and then something between.
He does test for that, because when you do an MRI, the MRI radiologist is going to say, they're going to examine every structure in there, and they're going to tell you whether or not there's tendonitis. So if your doctor didn't provide you a copy of the report, you ought to get one so you know what actually is going on there. But neuropathy doesn't tend to affect the heels first. It doesn't feel like you're stepping on rocks or something. It usually affects the ends of your feet, and it's numb, tingling, cold, hot, things like that. So what you've got is probably also a plantar tendonitis, fasciitis that needs some more physical evaluation. And the choice of gabapentin for me is otherworldly, kind of alien, bizarre, and just flat out weird, because gabapentin is a medication that's used for chronic pain and helps to disrupt the brain so it doesn't think of pain. Rather than disrupting your brain and hiding the pain, I think it makes sense to find out why the pain and get rid of it.
And that's exactly where I am. I picked up the prescription so I wouldn't make the doctor mad, but I'm like, I would rather do physical therapy. And then
here's a thought. Not picking up a prescription that's not worth taking is a really good idea. And if it makes the doctor mad, it's not a doctor, it's a prescriptionist, and you need to find a new doctor. That's all there is to it. So yeah. I would test that theory out first before assuming the doctor would get mad, because doctors hear that the patients don't take the pills all the time, and they just get a little flustered, but it's, they live with it, because there's not a lot of compliant people when you're getting edicts that you don't understand.
Well, and I don't take any other medicine, and I'm very hesitant. I told him very clearly, this is the pain is only, it's not there all the time, and it's a very low. Maybe it's a 1. And so that for me, I would never consider gabapentin for something that minor. That's like very weird. Well, okay, good. I think I might be looking for another doctor. And by the way, last thing I'll say is I get my 2 miles a day in most days, and motion is lotion is what I have said since my 2 miles.
Great saying. Love it.
So anyways, thank you for the information, and I will be looking at a different option before I put a pill in my mouth, okay?
Yes, go find a physical therapist.
Thank you.
Yep.
Thank you. Thank you very much there, Pat. I've got Michelle and Greg. Let's go to Michelle. Good morning to you, Michelle.
Hi.
Hi there, Michelle.
Hi. My husband's 74 years old, and quite a while ago he was diagnosed with dementia, and he's starting to really progress. You know, he's on a lot of medication, a lot. And I just want your opinion about the medication for dementia, supplements for dementia. I mean, I feel like I'm just feeding him pills, you know.
Yeah, so the medications that they say are, FDA approved for dementia don't really work much. They may delay the progression a little bit, flatten the curve a bit, but it still goes down. And then after 2 years, it just drops off usually. Unfortunately, most neurologists aren't aware of Dr. Dale Bredesen's book, End of Alzheimer's, Reversing Cognitive Decline. Dale Bredesen, Bredesen, End of Alzheimer's. I have personally been witnessing since 2006 reversal of dementia. But it takes actually somebody to work on this. The patient has to be very aggressive, and the doctor has to be very aggressive, and the medications that are normally prescribed for Alzheimer's don't work. They may hold off the deterioration, but you have to do an entire lifestyle medicine program to fix the problem.
Okay, so how do I find a different neurologist then? Because I'm on my...
IFM.org, Institute for Functional Medicine.org. You won't find a neurologist that's going to approach things this way because they are in a box, a prescriptive box. You need a functional medicine doctor because we are the only ones that actually treat humans with dementia instead of patching symptoms of dementia patients.
Okay. That is really helpful. I'm so glad I called. I've never called the talk show before.
I'm glad you called. You can get some help there. There's going to be somebody nearby you that's going to get you help. So just go on there and find somebody close by so you don't have to go driving.
Okay, awesome. Thank you so much.
You're so welcome. Best wishes.
Bye.
Very best wishes to you there, Michelle. Let's go to Greg in Fort Myers. Good morning, Greg.
Good morning, Dr. Fred. I have been listening to your show for a while and really appreciate your insight. And about 6-8 months ago, I dislocated my right shoulder, had it put back in place. It's doing very well, just get a little bit of noise out of it. And my left shoulder, I have a torn rotator cuff. And I recall hearing a show previously where you talked about a silicate complex and ursolic acid, I believe.
Yeah, it's actually orthosilicic acid, ORTHOSILIC. And that is an organic silica, and it's bound up with choline, so it's very absorbable. It is a drug in Europe. It's been studied for osteoporosis and for actually skin wrinkles. It'll actually get rid of fine wrinkles, kind of the plastic surgeon's bane. But if you use this supplement, it actually promotes collagen production. And then getting good protein intake also promotes good collagen production. There's a supplement called hyaluronic acid, and a specific company, BioIberica, makes one that is called synovic tendon ligament. And it has electron micrograph evidence of tendons reorganizing using the signaling from this specific protein supplement. And I used those two supplements, chiropractic, class 4 laser, and deep tissue massage, as well as muscle activation technique to heal both of my rotator cuffs, which have full function now with no surgery and no steroid injections.
Excellent. What kind of dosage and what kind of intake protein milligrams?
For a human body, around 0.75 to 1 gram per kilo a day is enough to actually rebuild your protein. And if you're getting the branded, it's called BioSil or Regenemax, that orthosilicic stuff, that 2 a day of that really helps to build collagen, helps to signal to the body. Vitamin C also. So if you eat a wide variety of plants and vegetable or fruits, you're going to get your vitamin C, but you might want to take an extra 1,000 to promote collagen production. But the class 4 laser is wonderful because it signals tissue regrowth and reduces inflammation. The muscle activation technique puts your posture in the right place so you're not abusing the shoulder.
Okay. Well, I'm fully functional with both of them. I really have very little pain, but...
Yeah, but the thing is, you actually did something with the motion of your body to rip the rotator cuff, so your body probably needs some new understanding about how to move so it doesn't do more.
Affirmative, and I'm also going to try and schedule an appointment with you. I understand you're now doing telehealth as well.
That's all I do, yeah.
Okay. Looking forward to it. I've called in a couple of times, but yet to hook up. But I will try it again directly.
Wonderful. Look forward to seeing and working with you.
Thank you very much there, Greg. And we are down to the last 10 minutes, so I'm going to invite your malingerers on out there to give us a call and participate in the Healthy Steps radio show at WMNF Tampa and address your medical questions and concerns to Dr. Fred Harvey by dialing 813-239-9663. That number is 813-239-9663. First caller is the first one we answer. You there, Doc?
Yeah, I got a few emails here. I think this is a good one. And just a reminder, this one came in through text, and I can't answer text afterwards. I can't email you back. So if you can actually email, that would be better. But when I get to the ones that are text, I can answer them online. And this is a good one. What are your thoughts on teen boys using anabolic steroids? I just saw an interesting story about this on CBS Morning News. It seems like fitness influencers are pushing more teens to hit the steroids for bigger and quicker muscle gains. Yes, we live in a cosmetically distorted society. Looks maxing is the key, but honestly, it's insanity to give teen boys steroids like that to make them bulk up. It's likely to cause physiological changes they don't want, possibly closing their epiphyseal plates, which is the growth plate in the long bones, closing them early, and thus resulting in shorter stature. So there's a really, it's just not a good idea for anyone who is not fully developed to be using steroids of any kind. Let's see. Here is one from Melinda, and she says, can you remind me what you can do prior to getting chemotherapy that will help your body prepare? Well, that's a really wide open question because there's a lot of different kinds of chemotherapy. And so I think the best thing you can do is what I tell everybody to do foundationally anyway. Take your healthy steps. Make sure you're getting restful, quality sleep. Make sure you're drinking good amounts of clean, filtered water. Make sure you're getting your rainbow of hopefully about 8 servings of fruits and vegetables a day. Get adequate protein to maintain your structures, which is, at least a 0.5 gram per pound per day. And from there, move inside. The rest of it's an inside job. So prepare yourself, understanding that you have an abnormality in your body that's being difficult, and reframe it as a bunch of lost cells who need help, and your body's going to help them find their way out of your body. And frame the chemotherapy as nectar from God, because a scientist created this wonderful solution to the problem you've got going on. And spend time in that quiet still point every day, setting yourself up for a good outcome. I think we have a caller.
We do, and I think I'm going to close the door to the phone room after Victoria, and let's go and see what Victoria has for us. Good morning to you there. What have you got, Victoria?
Good morning. I'm calling about a reoccurring eczema on my fingers, and I think part of the problem is washing my hands too much, but I'm thinking that there might be some foods that are exacerbating it, like tomatoes. I was wondering if I could hear about foods that exacerbate it, ones that help it, and what you can do to eliminate it other than steroids.
Good questions. Very targeted. The foods that might, like if you look at Ayurveda, red foods are going to make red rashes worse. So avoid your tomatoes because they're red. It's simple stuff. But tomatoes also have lectins in it that can irritate. And wheat has lectins in it that can irritate, but it also has gluten. Dairy, if it's pasteurized, which most of ours is, has advanced glycation products, which are toxic, immune stimulating chemicals that would possibly make it worse. So using a paleo-style diet like the WAHLS diet, Terry Walls has a food pyramid based in plants and lean meats and fish. Really brilliant stuff. But really, I think that topical exacerbation is really a key here. You probably wash your hands too much, so you need to get some good quality balm, salve for your hands, like bag balm that they used to put on cow udders, maybe still do. Shea butter. These are good things that really help protect your hands.
Okay, thank you. I'm using the bag balm and a couple other things. I also, once in a while, I'll use the hand sanitizer, and that just drives it right up.
Oh, no, you got to avoid hand sanitizer. That alcohol just strips the fat right off your hands.
Right. All right. Well,
they're the worst things you can do.
Okay. Thanks again.
So, best wishes.
Okay.
So, hey, I have, here's one that came in by text. Hello, Dr. Fred. I'm waking up every night at 2:30 to 3 o'clock. Can't go back to sleep very well at all. Oh, one of those tossing and turning nights. So, yeah, sometimes 2 to 3 in the morning is when your liver's backed up and you're processing. And sometimes it's just that you're processing a bad day. So look at things like, what are you doing before you go to bed? Are you turning off the TV at least an hour or any of your video an hour before you go to bed? Are you drinking any alcohol? If you're drinking any alcohol at night, that will often disrupt and wake you up at night. And so simple things you can do to help change that cycle, making sure you get outside in the morning to get sunlight on your body in the morning. It tends to reset the melatonin cycle, so you have a bigger surge of it when you go to bed. Maybe it'll keep you asleep longer. And if that doesn't work, you could try some magnesium glycinate maybe, or even a 1 milligram melatonin may keep you asleep. It's usually better for staying asleep, but that extra boost of melatonin might just help. But if that doesn't work, I'd say it's time to talk with a physician about that, because, yeah, you could probably get some help. So I think we're coming down to the end here, and I have time for multivitamins for men. Should I get any? Well, actually, there's good evidence that multivitamins actually are associated with less hospitalizations and better overall health. Is it because the people that think to buy a multivitamin are living more healthily, or does the multivitamin help? Not sure, but the evidence is out. They are helpful. I want to thank everybody. Great day. Excellent engagement. Thank you for all your calls and your emails. Thank you, Bill, for running the show in-house, and Sage for answering the phones. I couldn't do it without y'all.
And thank you, Dr. Harvey, for another informative and rewarding Healthy Steps radio show. And thanks to all of our participants and supporters. You make this show exemplary. And Sage, thank you for answering the phones today and all that entails. This show would not be possible without your assistance. You have been listening to the Healthy Steps radio show with Dr. Fred Harvey here on WMNF Tampa. Waiting for you like a dear friend is 5 minutes of NPR headline news, and then get ready for the Sustainable Living Show, hosted today by Annie Ellis. So until next Monday at 10 a.m., thank you for supporting and listening to the Healthy Steps radio show with Dr. Fred Harvey here on WMNF Tampa, your community conscious radio station. Stay safe, stay thoughtful, and know that you are loved.